When we look back at the medical history books and realize that the majority of surgical procedures used during the Victorian period were essentially medieval, we truly begin to appreciate how fortunate we are. A surgical revolution began as a result of some radical adjustments, but prior to that, many people had to endure a great deal of pain. In this episode, we look at gruesome and shocking facts about Victorian-era surgery. Chloroform was considered a practical anesthetic. The idea of surgery without anesthesia is unimaginable, but that was a grim reality in the past. In 1847, chloroform was introduced in Britain and used for the next 50 years. Doctors invented a mask that would be saturated in chloroform and then placed over the patient's face. After only a few minutes of preparation, surgery would begin. Even Queen Victoria herself was given chloroform for the birth of her last 2 children. Use of chloroform as an anesthetic eventually declined. Hot irons were used to stop bleeding. In Victorian surgery, where there was profuse bleeding from a wound, a hot iron might be used to stop the blood flow. Obviously, this was not pleasant at all, and alternatives to cauterization had been found long before the Victorian era. Many of the surgeries resulted in fatalities. Surgery in the Victorian era was lethal, but not due to the fast-handed surgeons. Instead, it was the high probability of infection after the patient left the operating table. Despite the pungent smell, doctors also believed that pus emitting from a post-surgery wound was a sign that things were healing well rather than what it really was, the result of a bacterial infection. The high death rate was just put down to ward fever. Barbers were recruited as surgeons during war. From the end of the Napoleonic Wars in 1815 to the outbreak of the Crimean War in 1853, there was a brief period of calm in Britain. During the battle days, however, barbers did a lot more than cut hair. They were enlisted as surgeons and expected to perform operations on wounded soldiers. Despite no extensive knowledge or formal training that extended further than that of an apprentice, a barber surgeon would be tasked with pulling teeth, bloodletting, and performing basic surgical tasks. The red and white poles outside of a barber's shop are a symbol of the blood-soaked napkins they used during bloodletting. Leeches would be used to extract blood. During the Victorian era, the ancient practice of bloodletting hadn't quite died out just yet. Victorian surgeons would use live leeches to suck the blood from the patient. The practice of bloodletting was harmful, as it could cause anemia, but doctors overlooked this for thousands of years. Hospitals were only for the poor. If you were lucky enough to be rich during the Victorian era, a family doctor would treat you at home from the comfort of your own bed. The poor would be hospitalized, and it was the role of the government, not the medical staff, to decide who would be admitted. Only 1 day a week was put aside for accepting new patients, and they would typically fall into 2 categories, either incurables, for infectious diseases, or lunatics, who suffered from mental illnesses. Surgeons wore their blood-soaked clothes with pride. Victorian surgeons were known for wearing their blood-soaked garments with pride, and they also carried with them the stench of rotting flesh as they made their way home. Being a surgeon was not considered the noble profession it is today, and the hospital bug catcher, who had the job of ridding the mattresses of lice, was paid more than a surgeon during this time. There were crowds gathered around the operating table. While patients would squirm on the operating tables and even attempt to run away during the painful procedures, onlookers would be there to enjoy the whole show. Operating in front of an audience was nothing unusual during the Victorian era, and the risk of germs entering the theatre wasn't even thought about. Well, we hope this video was insightful. If so, kindly subscribe to the channel.